We're getting an inside look at a controversial approach to the nation's drug epidemic, which has taken more than 100,000 lives in the past year. Overdose prevention centers like this give addicts space to use illegal drugs more safely, with trained staff standing by to help if they overdose. Supervised drug sites have been in use for decades overseas, but until recently, there were none in this country. Senior medical correspondent Dr. Narula got an inside look at one of the first two in the U.S. right here in New York City.
At this East Harlem Overdose Prevention Center, Sam Rivera is executive director and guardian angel to many struggling with addiction.
When they use in the street, they're hiding in an alley alone. They're hiding in a bathroom alone. If they overdose, no one's there. You get to respond immediately. And those are key moments because those are moments where some people will say, this is it.
You're the safety net.
Definitely the safety net in the moment while they're in their use.
That safety net is saving lives. On average, more than 2,000 people in New York City die from drug overdoses each year. In just the first 5 months of operation, the two centers intervened 283 times without a single death.
Give me a hug too. Oh.
Rivera knows all too well how illegal drugs turn lives upside down.
I created some pain in my own community, and I paid for it.
When Rivera was in his 20s, he spent 5 years behind bars on drug-related charges. In prison, he worked with HIV-positive inmates. That experience changed his life and led him to help other marginalized people using compassion and the concept of harm reduction.
The drug use exists. What we want to do is reduce the harm associated with the drug use.
Clean needles and other supplies reduce the risk of infection. Mirrored booths allow staff to watch for drug reactions.
They're not gonna push the actual drug into you, but they're gonna guide you.
After staying clean for 2 years, Christina Peterson started using heroin again during the pandemic.
They strive to I guess kind of teach people about harm reduction rather than complete abstinence, because that's not really the reality for a lot of people.
These are the overdose carts.
Program Director Kaylin C. says quicker response times allow them the option to use less invasive life-saving measures like nasal naloxone.
We're able to resolve 85% of the overdoses with just oxygen alone, and if we need to, we're just doing micro doses of the injectable naloxone. For those 100,000 plus overdoses America saw last year, if someone was there when it happened, those people wouldn't have died.
Taxpayer dollars cover wellness services, medical care, and connections to rehab. But since the drugs brought in are illegal, only private donations fund the drug supervision area.
For people who say you're just allowing people to come in and use, you're not getting them help,
we believe that abstinence and harm reduction are partners in this fight against overdose. You cannot recover, you cannot live your life, you cannot do the things you want for yourself if you don't survive an overdose.
Despite resistance from community groups, the program is allowed to operate without raids or arrests. New York City Mayor Eric Adams tells CBS News he supports the centers, and the Department of Justice told us it's evaluating supervised consumption sites as part of an overall approach to harm reduction and public safety.
I've been using heroin and cocaine since I was 16.
Omar Torres says the staff here gives him something he doesn't usually receive: respect.
How often have you been here?
Every day.
Every day.
No longer it's open, because then I open in the weekends, and I wish it was.
Yeah, why? Why do you wish it was?
Because in the weekends we don't got nowhere to go, so we gotta be in the hallways or in the streets, and people get mad at us, wanna fight us, throw things at us, call us names, and we're not animals, we're actually good people, we just got an addiction,
Sam Rivera wants this facility to serve as a blueprint for other harm reduction centers across the country, to offer more people the same second chance he got.
And to people who say you're bringing drugs into our community, we don't want these centers in our neighborhood.
We're in the neighborhoods we're in because drugs are already here. We're not coming in with them. We're keeping humans alive so they get an opportunity. And I can introduce you to hundreds and thousands who, because of these programs, are still here and are productive members of society.
You're taking something out of the darkness and bringing it into the light.
Yes, lots of light. And, people call it radical, and I call it righteous.
San Francisco and other cities are considering this model, which not only saves lives, but money spent on emergency services. Opponents in the community acknowledge there has been a reduction in drug paraphernalia litter.
But they remain
That's a good
opponents,
thing.
right? Because people think it's encouraging drug use.
Correct. And I think
I'm struggling a little bit with it.
it's a hard concept to understand, but harm reduction and these principles have been used around the world for 30 years. And the idea is
They're going to use it anyway.
they're going to use it. So now you're watching them. You're preventing that overdose. You're allowing them the opportunity to try to get to rehab. And many times it takes more than one time an attempt to rehab to get clean and
it's a
sober.
safe space. But how successful is this program in terms of getting addicts clean?
Right. So the center said they don't have the numbers on that yet. And that is definitely, obviously, one of the goals. But it's really to treat the whole person, to give them back their self-worth.
Yeah.
They have a clinic there. They have social support. They have wellness services. And as Sam said to me, this is about providing dignity to a population that is seen as disposable. Right? And
Or
they're
second
not.
chances.
And a second chance.
I like it radical. Some people call it radical. He calls it righteous.
Yeah,
Exactly.
I do like that.
The tough love, take it outside approach has not been working for decades.
Dr. Tara Narula, thank you so much. All right, and you can hear more of Tara's conversation with Sam Rivera on today's CBS Mornings podcast. We'll be right back.